I have a delicious vanilla cupcake here. It looks yummy, right? Most people would jump at the opportunity to take this cupcake if offered to them. Well, I'm here today to tell you about 1% of the population in America who would probably think twice about accepting this cupcake. That would be those who have celiac disease. Having been diagnosed with celiac disease 2 years ago, I am part of that 1%. I'm here today to explain a little bit about what celiac disease is, what causes it, and how it is treated, and how those with celiac disease live with it. Celiac disease is an autoimmune digestive disease that damages the villi in the small intestines, making it hard for the body to absorb nutrients. The villi are small, finger-like protrusions that absorb nutrients. In this picture, we see the healthy villi and the damaged villi. When the villi is happy and healthy, it absorbs nutrients. When affected by celiac disease, the villi shrink and can't absorb anything. When someone with celiac disease eats gluten, which is a protein found in wheat, barley, and rye, the person's immune system reacts by attacking itself, leaving the villi damaged. How does one know if they have celiac disease? The symptoms vary greatly from person to person. Some symptoms include vomiting, diarrhea, constipation, and weight loss. The symptoms are not always associated with the digestive system, though. Other symptoms could be irritability, vitamin deficiency, depression, infertility, and skin rashes. This makes it very difficult for doctors to diagnose a person. This is why it usually takes on average about 4 years for a person to be properly diagnosed with celiac disease. In my case, it was 3 years. As a side note, there are studies that have shown people with celiac disease have the genetic markers that it can increase the chances of developing celiac disease, but other triggers have to be involved. Celiac disease can be triggered by surgery, serious viral infection, pregnancy, or severe emotional stress. There are only 2 ways to confirm celiac disease. One way is through a blood test, where the antibodies are tested and the reaction it has to gluten. The second way of testing is a biopsy. An endoscopy is performed and a biopsy of the small intestines is taken, as well as pictures of the small villi, or the villi in the small intestines. These 2 tests will be able to confirm celiac disease. Once diagnosed, what then? How is it treated? There is no pharmaceutical drug that will heal celiac disease. The only way to heal is 100% avoid gluten, or living a gluten-free diet. This means completely avoiding anything that contains wheat, barley, or rye. This usually rules out things like bread, pasta, cupcakes, cereal, and most processed foods. Other items which may not be as obvious to people are dressings, gravy, soy sauce, French fries, chips, candy, and even hot dogs. That is why it is so important for a person with celiac disease to read the ingredient label. Even the smallest amount or crumb of gluten can damage the small intestines. The longer a person damages the villi or continues to eat gluten, the longer it will take for them to heal. Without treatment or without doing a gluten-free diet, people with celiac disease can develop more complications. Other complications include osteoporosis, anemia, and even cancer. Gluten-free products have become more and more available in mainstream stores, which is good news for those of us with celiac disease. Each year, the availability of gluten-free food is doubling, and as people become more and more aware of gluten-free items. Now that you know about celiac disease and what it is, you can understand what labels mean when they say gluten-free. It means they are free of wheat, barley, and rye. This cupcake is gluten-free and was purchased from a 100% gluten-free bakery. That means people with celiac disease, like myself, can enjoy yummy things like this cupcake.